Namaste, good evening. Toxic positivity is a societal assumption that a person, despite their emotional pain or gravity of their situation, should only strive to have a positive outlook. And we all know the only journey is the journey within. With that note, we would like to welcome two special guests today. Dr. Nidhi Thanawala. Ma'am is a therapist and a psychology professor at one of the topmost colleges in Bombay, HR College. And we also have Mehezabin Dordi. Ma'am is a clinical psychologist and she is with the Sir H.N. Reliance Foundation Hospital. Today, we'll be talking about the importance of toxic positivity. Seriously, I never knew how can toxic be positive. But welcome to Turiya Talks. Yes. So, ma'am, my first question is, how can positive be toxic?
Okay. Thank you so much for this opportunity and welcome everybody. I am so happy that I'm speaking on such an important topic today. And to answer Sandhya ma'am's question, this is something that is the first reaction that people have that, how can something like positivity be toxic? If positive is not positive, then it's maybe a Kalyug that we are living in. So, what happens is that we need to accept the little nuances of our life, of our society, of our culture, the way we behave, the way we think, and most importantly, the way we feel. Okay? So, when we are mentioning or when we are talking about something like toxic positivity, what we talk about or what we really mean is that it's something which is dangerous, keeping up an entire aspect of life, keeping up that things should always be light, things like, good vibes only, or be happy all the time. It's all about the mindset. So, an only positive mindset, like it's the only right way to live your life. And this is something which could be absolutely excessive because people would want you to be positive all the time. One sign of anything slightly negative or sadness, not just people around us, but even us when it comes to emotions like anger, emotions like jealousy, we are not very happy that we have these kind of thoughts because we are not taught how to deal with it. So it is excessive, it is ineffective, and it's overgeneralization, things being happy all the time. To be, in a fun or an optimistic state, look at glass half full, always focus on the positive aspect of things. So, and this entire thing can be something which is very dimming. And DIM is, so DIM is one of the acronyms that I have made, and what it stands for is that it just diminishes or it denies you of a core human experience: sadness, anger, frustration, jealousy, parts of maybe hate also. All of these are human emotions. We need to deal with them, we need to learn how to express them. Okay? So it denies these things, it invalidates them, and it minimizes them. So if a friend calls you crying about, something somebody, one of her co-workers told her, you say, look, that's not a big deal. So you are minimizing what happened to her. She is trusting you and opening up to you to call you in that moment of need. So there are ways, instead of dealing with that, what we are doing, be positive, look at the good aspect of your job, or don't think about these things. Or you say, oh my God, I can't believe you're crying about it. I thought something happened to someone, or like, it's some COVID thing or something like that. So what you're doing, you're invalidating the entire experience, saying this is not something worth crying about. Your emotions are not how they should be. This is as good as photoshopping our feelings. See, every time, just as we put filters on our pictures, okay, we put filters on our emotions. And while there is nothing wrong with putting filters on our pictures, but every time you put a filter on your face, where you clear your skin, you making your eyes bigger, or the thousand effects that people put, you are somewhere telling that you are not good enough the way you are because you are putting those filters. Similarly, in times to be more and more positive, when you push your feelings, you are repressing them, you are not expressing them, you are not giving them the channel, you're not giving them the outlet that they require, and that causes certain kind of disturbances. And that is not good for your peace, that is not good for your life, and it's certainly not good for your mental health. So we can't be,
Right,
something positive that's all the time.
right. I would like to ask Dodi ma'am something very interesting from clinical perspective.
Mhm.
Same question. Again, I think my viewers will be little confused that how can positive be toxic? And what is toxic positivity? TP, I think in your clinical language, what you call it. So we would like to understand things from you, please.
Right. So essentially, toxic positivity, like how Dr. Nidhi explained, the toxic positivity is something that is, we excessively focus on being positive without having the overall experience of our emotions. For example, when somebody tells me that, oh, my spouse dumped me, oh, you'll get over it. Oh, you've been diagnosed with cancer. Be positive. Oh, you've been lied to so many times that you don't trust anyone. Stop being so negative. These are the examples of toxic positivity. Majority of the times, though, we see that such statements come from a place of love. But also, when we look at it at a more clinical aspect, it is also featuring some blissful ignorance. It comes from a place where an individual does not know how to respond to somebody else's emotions. And this is something that we do to others as well as ourselves. This ignorance is something that we cater to within ourselves as well as other people. But all these phrases, all these things that we say to other people contain a certain degree of denial of an undisputable part of our existence, and that is suffering. Toxic positivity, as Dr. Nidhi rightly said, is refusing to see negativity when it's the elephant in the room. It is like brushing undesirable stuff under a rug and not paying attention to it at all. Like an attempt to force happiness by rejecting any form of undesirable emotions or certain aspects of an event. So that would be my understanding from a clinical perspective as to what toxic positivity looks like.
Right, right. Ma'am, I think I would like to get this answer from both of you. What's so bad about toxic positivity?
Okay. Now, see, what happens is that, first of all, the worst thing about it is that most people don't know that it exists around us. It's everywhere around us. As I mentioned earlier, it's a part of our culture. Sada sukhi raho. Wish both of you a forever of happiness and a lifetime of happiness together. Now, and this is something that we tell people when they get married. So, society doesn't prepare a couple for getting married. Bollywood doesn't help either, that you're going to be happy forever. And everything is always going to be positive. Just like any other relationship, marriage requires so much hard work. So, when you focus only on the positive aspect, if the couple has certain roadblocks, which they most certainly have, they feel like personal failure. That we are not supposed to have that. We are supposed to be happy together. See how much we are fighting. Now, all couples fight. In fact, there are fights in all kinds of relationships. So that is something that happens around us. Like I said, you'll see diaries like "Be happy," "Positivity is a mindset." But we also need to look at that these are the diaries that have a unicorn riding on a rainbow, and that's not going to happen. So similarly, you're not going to be happy all the time. You're not going to be positive all the time. A very important aspect here is that people don't even allow us to process what is called as natural sadness. Now, I get asked this again and again. So, just like anger or jealousy, so if you tell somebody that, oh, I think I'm jealous of her, that person will automatically judge you because it is a bad thing. But maybe it's not really a good thing, but it is a natural thing. It is not taught to us how to deal with it. At the same time, there is a very strong emotion which is grief. Okay? Society in general or people don't know how to grieve or how let other people grieve. So if you come to know that someone's lost, a loved one due to whatever reason, and you go to them and they're crying, you say, don't cry, don't cry. Here, have some water, don't cry, don't cry. So we feel that it's upon us to take that as a project to fix that person. If you can't make that person happy, make that person unsad. Okay? So many times, as a professor, as a therapist, as a life coach, people have asked me over last 13 years, I've been answering this question, where they come up with a unique situation and say, what is the right thing to say here? Okay? So if somebody is grieving or something, what can I do to make that person feel better? Now, if you've lost somebody, you are not going to feel better. You're not expected to feel better till certain amount of time passes by. So when we try and be positive around that, when we say, "Arey, that arey, but the person was old, or the person suffered a lot, or God needs good people," there are these 10 to 12 standard statements that we kind of throw around. So that entire onus on making the person unsaid, it's something which is extremely heavy. Now, like when it's been rightly said, that all of this is also coming from good intention. You want to help out, you want to be a good friend, you want to be a good parent, you're trying to do good, but there is good actually happening here. So what happens similarly, when you're a mother, okay, when you try and complain, you're like, "Oh, God gave you a child. There are childless couples. Be grateful." Okay? And other people, who are not married, who are not mothers, they'll say, "You're so lucky, such a cute thing you have to play with all day." But those of us who are mothers would know what a taxing job it is. And the society doesn't allow us to process that, to complain as a mother, that I get tired sometimes. So I have a blog called Kaisi Maa Hai. And the reason that I named it that way and not the mom manager or, the other fancy thing is because all of us judge mothers. Okay? Because we put that entire experience as positive all the time. So as a mother, you feel that I'm not a bad mother. What kind of a mother I am that I'm not enjoying motherhood, or I'm feeling, why doesn't the child shut up? To come to your question in a more precise manner, that why is this such a problem? Because again, I have an acronym here for toxic positivity, something which is called as bleed. That we need to be, even in order to be happy all the time, we follow certain rules. Okay, so we bleed to be happy. So B is for being cautious. So those of you who have, or for Edward de Bono's work in his classic six thinking hat, says a black hat that says be cautious. So even when you're excited about something and you're looking at the bright side and creativity, you still look at caution. Okay, you look at how things can go wrong, okay, so that you can fix them. Okay. Then there is L, which says let go. Okay, sometimes letting go of something that you cared about very deeply. Okay, which is not really very positive, but it is going to give you a lot of peace. Okay, then there is I, of being ignorant. Now, against my profession that I hold oh so dearly close to my heart for over a decade, sometimes I do feel ignorance is a bliss. Okay, and the last one is D, which is for detached. That unless you don't detach yourself from certain things or people or situation, you can't be happy or positive. So, not everything about positivity is positive. Okay. Also, the reason that it is such a problem is because it does not allow actual human expression the way it is supposed to be expressed. Okay? So it is something which is, you can also say, to do with how we deal with our everyday life. Okay? Because suppressed emotions, they become bigger and more significant if they are unprocessed. At the same time, you need to pay attention to your emotions, how they are, how they come and go, how they're affecting your everyday mood, how they're affecting your everyday decision making. Once all this is done, it gives us a lot of clarity into our own behavior. And that allows the emotional expression the way it is supposed to be, and that is really helpful.
Right. We are talking on something very interesting, that's toxic positivity. I'm sure people after this show, they will Google that how can positive be toxic? What is natural sadness? What's so bad about toxic positivity? Hmm? How to avoid it? Uh, do we need to actually take self-care? I think so many viewers are there, and we can take a few questions also. Can we get those questions displayed, Asad? We'll just quickly take it up because we have got many questions. Can we get those questions displayed, Asad? Yeah, so we have a question from Abhilash, and he's asking, due to society, people do not talk about their internal health. How should a person deal with it? Ma'am, will you say from a clinical perspective, please? Dordi, ma'am?
Sure. Yes. So, Abhilash, the most important thing over here is that it is actually very naive of an individual to expect that human beings can be perpetually happy or happy on the. Sure, there might be a few exceptions in the world, but that's again very rare. every individual in themselves is experiencing some or the other negative emotions, whether they overtly talk about it or they don't. The whole idea over here is to normalize the fact that it is okay to have certain emotions, it is okay to have the whole spectrum of emotions, and it is okay to talk about it. So normalizing it, and the only way that we can actually normalizing it is by talking about it ourselves and allowing people, when they talk about it, to listen to them, what they have to say, to listen to their perspective and not judge them. So I think that's one thing that you can do to help cope in a better way and to create more awareness overall about the mental health.
Right. We have next question from Swayamprita, and she's asking, "What is your approach to the therapy?" I think both of you can talk about it.
Okay. So, okay, so I'll start. Now, approach to therapy is ideally, especially as I'm concerned, and I don't really know from where this question is coming. Maybe it's coming from a future client or somebody who's considering therapy or somebody who's studying psychology and want to be a therapist. In both cases, amazing. But let me quickly tell you that when I was a student, there were different kind of approaches that we were taught, but life is mm, rarely that simple. So what happens is that personally, my choice was, as much as I used to like psychoanalysis back then, and Gestalt was my favorite. It made so much sense to me. But rational emotive behavior therapy is something which is most widely practiced because behavior is something which is easier to observe. Also, people don't really have a lot of time when they come to a therapist because that's of not really their first choice. So most of the time the issue gets out of the hand and then they really go to a therapist when they really starts to bother them. But personally, if I had to answer this question, I focus on solution based therapy, which has a shorter number of sessions. So most of my clients, 3 or 4 sessions, and then they are done, and then it's just follow up.
Right. We have a question from Kingshu Kundu, and he's asking, "Are there any guidelines set to get through the anxiety and depression phase?" Dodiman,
Uh,
yeah, you can take it up. Yeah.
Sure. So, so first of all, I would like to say that anxiety and depression, though they are very commonly used words, it's not one size fits all. Most important over here is to understand as to where that problem is coming from, and depending on what causes the problem comes the solution. So depending on what is exactly the trigger factors, for example, what is making you anxious, what is making you depressed, looking at those factors is very, very important when we talk about how do we form a therapeutic intervention around it. Factors such as their own personal life, their social environment, what's happening in their life, what stage of life are they at, becomes very, very important and crucial. So basically, also to add on to Dr. Nidhi's previous question, therapy is not something that is one size fits all. It is a very, very individualistic and a very curated experience that depends on multiple factors of an individual.
Uh, we all know that what mental health needs is more sunlight, more candor, and more unashamed conversation. So, does it help to heal the problems? We'll get to know all these answers if you further watch the show. We have next question from Ruchika Dubey, and she's asking, what kind of tasks do you give to your patients when they come for treatment?
Okay, so see, Ruchika, what happens is I think that this is a huge set of people who are really, really intrigued about the concept of therapy. It is as good as asking a physician or somebody who's an oncologist, how do you treat cancer? Okay. So years and years of studying and practice goes around into answering a question like that. Even the gentleman who asked a question about anxiety and depression, I would like to tell him that we need at least a 3 hour session on how to cope with basic anxiety alone. So when you put such mammoth things together in a question, I wish we were equipped to, or anybody in the world was equipped to answer it in 2 lines. So what we do with our clients is something which is absolutely catered. Okay, so I wish we were like those old school compounders that the general physicians had. They had that entire, wall of colorful tablets. Okay, and then they would look at it and they would two from here, two from here, two from here. There was something which was written there in their hand, and they'll see, and they'll make a nice little, dry cocktail out of it with this, medicine bale, and just give it to us. Okay, how we wish therapy worked like that, but it does not work like that. So there are a lot of exercises, there are a lot of treatment plans, there is an entire intervention plan, there are trajectories. So there are session notes, which are crazy detailed notes. There is a lot of work that we do in between the sessions. So all of this is how we are taught to do it. But to give you a better idea, or a general idea, that there is a plan which is absolutely tailor made for that particular person. So if, let's say, a set of twins, okay, both of them come up with an entire diagnosis or a problem of anxiety, because this is what we were talking about, and these are people who are born on the same day, living in the same house, they're the same age, they go to the same college, they are experiencing the same thing, their treatment plan may be as different as any two different clients. It is that customized. Okay. So if you ask somebody, how was your experience in therapy? While it's fine to get somebody's, word of mouth, and we all want an experience from somebody that we know personally, because then we can count on it all the more. Your experience may be completely different. There are times as a therapist that I have said no to taking few cases because I thought that I wasn't comfortable with that client, and I give all my clients that option as well. So that is the reason I don't charge for the first session, because the first session is more of a test for me and them to see if we get along very well and we will be able to take this forward. So that is a chance that they get. So therapy is something which is extremely private. Okay? And while it is okay to share things with your friends and they have the best of intentions at heart, they may not really be experts on how to solve the problems. They are not professionals. Okay?
Right.
So a lot of times I've had people come to me and express this is happening to me, and then they think that she'll be surprised, or mine is the most unique problem in the world. And then once they finish, we ask, is this also happening? And they're surprised, like, how did you know? Because as experts, as professionals, we have seen a lot of those cases. Okay? So
I
again,
agree.
to sum up the answer, it is highly private and customized.
Self-care is how you take your power back. And we all know that healing takes time, and asking for help is a courageous step. Since we have a, well-known clinical expert, I would like to talk about something very, very pertinent. I think it's very important. I would like to talk to Dordi ma'am, and I would like to understand
Hmm.
impact of such cases in chronic illnesses, and maybe we would also know what's happening in COVID cases. So if you can just talk about it, please.
Yeah. So, to talk about chronic illnesses from a toxic positivity angle, the most important thing is that when we look at somebody who's suffering for a very long period of time, our intentions towards helping them are very good. But because of the passage of time, what happens is then we kind of skim a little bit on the empathy bit. A lot of times, a lot of my patients say that जब initially मुझे problem शुरू हुई थी तभी my family was very supportive, but now since it's been a couple of months and this and that, my wife keeps fighting at me, my wife keeps yelling at me, my children don't listen to me. अरे आप तो वापस कमर का दर्द लेके बैठ गए, अरे आपके तो कीमो चलते ही जा रहे हैं, चलते ही जा रहे हैं, 6 महीने हो गए कीमो खत्म नहीं हो रहे हैं. These kind of things come up very very often. So, toxic positivity in such cases could be statements such as, everything happens for a reason. A lot of my oncology patients, so I deal with a lot of oncology patients, both acute as well as chronic. So, a lot of my patients tell me that this is what their relatives and their friends tell them all the time, that everything happens for a reason. What doesn't kill you only makes you stronger. You'll be fine. It's okay. Everything works out in the end. You will get over it, you will get used to it, especially for people who suffer pain on a day-to-day basis. Don't worry, be happy. These are the things that we hear very very often. Again, I'm not saying that we don't look at the silver linings, We don't look at the good things about it, but there is a very huge difference, a huge spectrum between genuine optimism that yes, things are going to be better, and toxic positivity. Having toxic positivity as our default response to any situation causes minimization and invalidation and denial of these experiences. Somebody who's suffering from a condition that is probably life altering, and we say, ha, theek ho jayega. So that is minimization and invalidation of their own individual experience. By disallowing their existence of certain feelings, by not allowing them to feel a particular way, especially with individuals with chronic pain, that can fall into a very dark state, which can cause denial, repressed emotions. People don't talk about it. And because they don't talk about it, then they develop a secondary mental illness over a period of time. And this also breeds a lot of stress. And we all know, we don't need a clinical psychologist to tell you that stress is not good for your health, whether somebody is ill or somebody is well. So, this is something that is very pertinent when we talk about individuals who have chronic illnesses. And that is precisely the population that we cater to on a day to day basis at our hospital. And to answer your second question, Sandhya, about toxic positivity and COVID. Now, COVID is a scenario which I don't think there's anybody on this planet who's not aware of what COVID's done to us, right? Otherwise, they'll be living under a massive, massive rock if they don't know what COVID is. And toxic positivity in this scenario is especially harmful. Why? Because this pandemic, somehow has triggered our need to exert more control. Uncertainty is something that human beings are not comfortable with on a general basis. And the power of control is precisely what has been taken away from us because of this COVID situation. And with something so unpredictable, our knee jerk reaction is to slap on an overly optimistic face on ourselves and avoiding accepting the painful reality. But reality is painful right now, and there is so much of chaos in the world. Stay at home orders have been given everywhere. People still aren't able to go to their jobs. Companies all across have laid back and laid off millions and millions of employees. People who are fortunate to have their jobs have to work from home while they deal with their family, children. They're teaching their children at home while working. So a lot of multitask is happening. Many people, many medical care providers are under a lot of stress right now, with intensive care units running out, death tolls are rising. It is a very, very difficult situation right now. And collectively, if we look at it, there is a lot of feelings of loneliness, anxiety, fear of getting sick, and a lot of uncertainty. I'll tell you a little bit about a recent study that I myself conducted on mental health care workers, on healthcare workers from a mental health perspective, that showed that approximately 25% of the doctors in the country are suffering from signs of depression, and 34% of nurses are showing chronic emotional distress. And this is something that we were quoted in Times of India as well. So, toxic positivity in this scenario is invalidating all the real hardships that people are facing in such a situation. There is unnatural pressure of being productive, which leaves many, if not most people, feeling inadequate, ashamed, guilty, and simply, trying to pull through the day without having any panics or without having any crying spells. Yet, we see social media, which is flooded with positive quotes, taking advantage of the quarantine, be productive, get a side hustle, bake a cake. All these sorts of things are something that we're flooded with. But not everyone copes with anxiety and stress by being busy, right? And for some people, these messages are all the more harmful, with leading to increased feelings of depression and anxiety. During trying during these times, our brain are full because of the stress, because of everything that's happening around us. Our brains are filled with all sorts of thoughts, and we do not always have the cognitive capacity to take up a new learning course. Like Dr. Nidhi rightly said, Udemy certificates, I'm seeing them left, right, and center on my social media all the time, and I wonder where these people get the time from. So सो इमेजिन दैट पूरी जिंदगी में कभी हमने शेफ बनना नहीं सोचा था, पूरी जिंदगी में कभी हमने केक बेक नहीं किया था. तो डू यू थिंक पेंडेमिक इज द राइट टाइम टू स्टार्ट समथिंग लाइक दैट?
And
So
I'm
this
so
is
sorry to interrupt, but making mandalas, everybody I know are sitting and doing intricate mandalas, and here there is work from home and there is so much pressure. So again, I wonder, who are these people? Where are these people?
I think people are saving a lot of time by not commuting much.
yeah.
So when we commute, I think we exert a lot of energy. So by not
Yeah.
traveling, I think people don't get tired much.
Yes,
So they think
yes.
of
And these are also the people who may have a lot of staff at home because we are
hmm.
not commuting, but we are. But anyways, the focus is, on social media. So the focus is that, as Mer's been rightly said, that when you open your timeline, you see all good things, which is fine. I'm happy for all these people. But nobody would post about their struggles. Nobody would post about their, like she's rightly said, bad decisions. Nobody would post about their regrets. Nobody would post about their fears. Okay, so there are people who are bungee jumping, but nobody's posting a picture of I almost bungee jumped or I went here, and there are pictures of all those places. But I wish I could have the courage to do this as well. Okay. So when we see something like this, when you open your timeline and you only see pretty things, when you only set those, cake baked faces with makeup, you are looking at something which is positive only, and that's not how our life is. So that sometimes make us feel more inadequate. Okay, then what we are, or then what we should feel. But that inadequacy is also again not something that we are sharing with anybody, and that is what is toxic positivity. People talking about their positive experience is not, but we comparing that, assuming that that's all that there is to their life. So there are people who are shouting at their spouses, they're considering a divorce, and then there are celebrating anniversary on social media, as you showcasing the prettier parts of their life. Now that sets a certain kind of benchmark for others. So peer pressure in internet was, a self-esteem and all that was a part of my PhD thesis, so I could go on and on about it, but I think this is all that we need to know in terms of toxic positivity aspect of social media.
I think last question for today's show, it can be, I think you talked about something called natural sadness.
Mhm.
My question would be, what is natural sadness and how to avoid it? I think we can get
Okay.
perspective from both the experts.
Okay. So, like I said, natural sadness is things when you are to do with the grief. Okay? When you are really trying to overcome grief, or you're trying to fix somebody who's overcoming grief. How to avoid toxic positivity? So, I'll do a quick bit, and Mezbeen, I'm sure, has a lot of details because she has come across over more than 1,000 COVID patients. So, that's amazing. Okay, so congratulations on that. Okay. But let's look at very everyday scenario. Okay, so when you see that somebody, like I said, your friend calls you, or he or she is in tears talking about, some co-workers who's been really catty or mean, you say, okay, just be positive. So instead of, now see, this is coming from a place of help and love. So instead of saying just be positive, what we need to focus on, that I know that this could be difficult, this must be really tough right now, and things can go wrong, but let's focus on what you can do. Okay, what let's focus on, even in this situation, what is it which is right. Okay, so otherwise you say, oh, you'll get over this soon, this is just a phase, this too shall pass. Now it's nice to be hopeful. Hope is the reason all of us are alive, but at the same time you really need to soothe the person as well. Now how do you do that with word? You can say that you have survived hardships before. One thing that you don't want to do, okay, is to diminish the person, saying stop sulking, just like stop being this person, like I don't like this face. Okay, so just stop being sad. Okay, or you're just saddening the whole vibe, you're killing the mood. Yeah, don't be this person, chalo chalo, cheer up, cheer up. Okay, now we wish that it would happen like that. Neither you want to say you think you have it bad, you don't know what those people did to me, my workplace is the worst. Okay, so instead of comparing that or saying the same thing happened to my brother, he did this, so you also do this, and this will work for you. So what, instead of these things, what are you going to tell them? That I know you feel terrible right now, but would you like to do something that you think is fun? Or, I'm here. Just let me know if there is anything we can do together. And then maybe you can present options about the things that the person had liked. Okay? Or instead of comparing them to other people, you can say that it's okay that you're struggling. Everybody copes with things in a different way. Let's figure what would make you feel better right now. Okay? A lot of times people say that failure is not an option. Impossible is a word which is not in my dictionary. Again, it could be inspirational and
Right.
motivational, but for somebody who's struggling, not so much. So, in case you tell them that, see, this is also an experience where we can learn, we can grow, and success is, better after failure. You value it more, you have earned it more. If it's all going to be, super fast success, it's not something which is going to be learning and fun. Okay. And maybe to, just end, because this is the last thing I like to tell people, keeping in mind toxic positivity, that every day is not a good day or the best day for us, but we live every day. Okay? So there is hope there, and at the same time, if you have a bad day, don't be like, "Arey, what did I do?" It is a bad day. Fold up the day, put it away, and that's all there is to there. Okay, so yeah, so I guess
Right.
I'm done with
Dordi
that.
ma'am? Yeah.
I think Dr. Nidhi put it very nicely that some days are just days. They don't have to be good days. They don't have to be best days, but you pull through nonetheless. Adding a little bit onto that and adding to already what Dr. Nidhi has already covered is I would like to add how do we deal with toxic positivity? The first and the most important thing is that we avoid ignoring and stuffing away our emotions, right? There is a brain imaging study at UCLA that shows that putting our feelings into words reduces the anxiety and the intensity of our emotions, such as sadness, anger, and pain. So talking about it, expressing our emotions, expressing how we feel, all the emotions, whether good or bad, helps. Also, when somebody is talking to you, like Dr. Nidhi rightly said, that everybody is entitled to their own feelings. Don't shame another person because they are experiencing certain feelings. It is really important that we acknowledge that different people cope with different situations differently. Also, building up on that, it is important that we remember that it's okay to not be okay. Sometimes it can be overwhelming. Sometimes life can be exhausting. So give yourself that permission to rest and do something imperfectly, free of guilt. Also, another thing that we usually really don't pay attention to is emotions are not necessarily something that are black and white. Remember that feelings in itself are not mutually exclusive. For example, healthy positivity acknowledges the fact that authentic emotions, that is, things that we experience on a day-to-day basis, may not be extremely positive. What it essentially means is, let me give you an example. Okay, so you can be sad about losing your job during the pandemic and be hopeful at the same time that you'll find a new one, is what I'm trying to say. That we can experience two feelings at the same time. Also, while we are dealing with emotions, it is important to be a little realistic. Everybody wants to climb the Mount Everest, everybody wants to bake the perfect cake, everybody wants to become a gourmet chef. But it is important that we set realistic goals for ourselves and focus on those to help ourselves feel better. And like Dr. Nidhi rightly said, recognizes the toxic positivity messages that we send out to people. Positive vibes only, choose happiness. The reality is that there is no positive vibes only. There are vibes, both good and bad. And it is important that we acknowledge them in their entirety. And the last but not the least, it's okay to be wary of social media because it can depress the best of us at some points in time.
Seriously.
So I think these are the few things that I would like to add to how do we cope with it.
Right. I can only say that health concern, I think it's a major concern. And of course, India is not far behind in sharing this. Going forward, I think two experts, they have discussed new approach, how people can adapt that with renewed vigor. And to all of us, I think, including me and everyone, our mental health is a priority and our happiness is an essential thing and self-care is a necessity. So with that note,
Realistic happiness.
yes. So with that note, I would like to thank both the experts for taking out time from their schedule and talking about something very interesting. Uh, Not all days are dull and bad. So today we talked about toxic positivity. But on this Saturday, we will talk about Christmas celebration with Lily Petler. And she will talk about how Christmas is celebrated in different countries and what this celebration actually defines. So till then, thank you. And one last message. I think I didn't ask you. Your final message for Turiya Talks. Your final message for Turiya Talks.
I think the only thing that I could say for Turiya Talks is, first of all, thank you so much for inviting us on this platform and letting us talk about our own experiences and our understanding. Also, I think you're doing a phenomenal job, so please keep at it. And we need more of such sessions on a regular basis so that people around us are more educated, more aware of what exactly is happening. So I think keep up the good work and good luck for 2021.
Yes, thank you. Same to you. Yeah.
Thank you so much for the opportunity. And it's very nice that there is a platform that deals with a variety of things. And you're looking at certain things like toxic positivity. At a lot of places, people talk about anxiety and depression and just, mental health and mental illness in a very general sense. And while that is also required, but I do believe that there is a lot of content on that already. So if we start looking at something as nation, it's really visionary of whoever suggested this topic to have done that. So thank you so much, and I'm really, really hoping that all of us, everybody, all the viewers who are live or who are going to look at the recorded sessions later, will try and identify these behaviors in their own lives. We'll try and correct it to whatever extent possible, and be slightly more happier and more at peace. And they would have you to thank for that.
Right. Thank you once again for empowering our audience with the coping mechanisms. As I'm sure it will help us to survive this pandemic with courage.
Mhm.
Not only that, but grow with it. And so I think only can say that cope with hope. Namaste. Thank you.
Thank you.